Good afternoon, everyone. My name is Aline Shurmoff, and I'm the Senior Vice President of Community Development and Engagement here at the Minneapolis Fed. I'm pleased to welcome you all to our virtual convening centered on addressing barriers foreign-born workers face in the labor market. We thought it was important to hold this discussion because we know that in states that in the 9th Federal Reserve District, which is the region the Minneapolis Fed serves, and other states all over the country often cite how difficult it is to find workers. We also know that many states have started to look to foreign-born workers to help address those shortages. Better understanding of how occupational licensing is affecting these workers is also a critical part of our team's mission of advancing the economic well-being of low to moderate income people and communities across the 9th District. And it's part of the Federal Reserve System's mission of achieving a strong U.S. economy and maximum employment. In our time here today, we want to share some of the exciting work the Minneapolis Fed has done on these issues. Our Assistant Vice President of Applied Research, Ryan Nunn, will begin by highlighting the research his team has done on how occupational licensing can be a barrier for foreign-born workers. Ryan will also introduce our first-of-its-kind occupational licensing dashboard, a tool that provides easy access to key licensing data at the state and occupation levels. Next, we will hear from a panel of subject matter experts from the government, nonprofit, and academic sectors about what states are doing to better support foreign-born workers in the workforce. With Minnesota's new Permanent Office for New Americans and North Dakota's new Office for Legal Immigration, we know that these are timely issues here in the 9th District. Our panelists today are joining us from the American Immigration Council, Kansas State University, the Immigrant Law Center of Minnesota, and the Minnesota Department of Employment and Economic Development, and we are honored to have their perspectives. I'm excited to be kicking off this important conversation, and I want to thank you all for joining us. I'm now pleased to introduce Assistant Vice President Ryan Nunn for his presentation.
Great. Thank you very much, Aline. And thank you to all of you who have tuned in for this discussion. My name is Ryan Nunn. I'm Assistant Vice President for Applied Research here in Community Development and Engagement at the Fed. I am a labor economist, and I've had a focus on occupational licensing that allows me to be really excited about being able to talk with you about this work today. I think that the work you're going to hear about just over the next 15 minutes or so gives you an important basis in evidence for some of the panel discussion that we're looking forward to just after this. This is work that's joint with several of my colleagues, but most importantly, Tyler Besch, a data scientist here in community development. However, the views that you'll hear from me are just mine and not necessarily those of anyone else at the Minneapolis Fed or in the Federal Reserve System. So I want to start with just a bit of licensing 101 to kind of give you the high-level overview of where we start here. We've learned from research on occupational licensing that while it was once a pretty marginal labor market phenomenon at around 5% of the workforce at the middle of the 20th century, that's grown to nearly a quarter of all workers in recent years. And that's a combination of occupations becoming newly licensed, as well as the growth of the service sector, where occupational licensing has been more common for quite some time. We think it's really important to understand exactly who is licensed. It's quite uneven across the country and across occupations. And some demographic groups are substantially more likely than others to be licensed. So we want to unpack all of this in the work that we're about to show you. There's growing evidence really just in recent years with some newly available data I'm going to talk about that indicates the consistent evidence that licensure is reducing employment for workers. We find that those employment reductions are larger for immigrants, but we're contributing to this larger body of work around labor market effects of licensing. It's important to note that licensing absolutely has an important public safety role in many instances, but the details really matter for minimizing costs and maximizing access to opportunity for workers. And that's a big part of what the panel discussion is going to get into. As I mentioned, we have this relatively new data from the statistical agencies that helps illuminate licensure at the worker level. And it shows that licensed workers tend to have more education, they're less likely to be unemployed, they tend to receive higher pay, amongst many other things. Licensure is especially common in some economically critical sectors, including healthcare. I should define licensure along the way, just so that we're all kind of on the same page. These new data define it really the way that labor economists have, which is in terms of a credential that's issued by a government, local, state, or federal, and that's legally required for work in the occupation. So we believe that these data on licensure can be really useful for helping understand both who is licensed and what effects licensure is having. At the occupation level, there's quite a bit of variation in licensure. So these are some pretty large occupational groupings. At the top, you have healthcare practitioners, so physicians, dentists. About 3/4 of them report being licensed. That rate declines as you move down this graph across other occupational groups. But what I want to highlight here is that there are occupational groupings that are less commonly associated with licensure, like personal care, where you have childcare workers, where you have folks like barbers, where licensure rates are quite high as well. And so what we're going to do is, really explore these occupational differences in what we show you in just a moment. It's also the case that those with more education are licensed at substantially higher rates. So folks with more than a 4-year college degree, nearly half of them are licensed, with rates that then decline for workers with less educational attainment. Licensing comes with educational requirements, so it's not any particular shock that you see this pattern. But it's also the case that education would almost certainly be required in many of the jobs that are licensed, even in the absence of those specific requirements. But all of what I have just talked about is really at a high level. That's the big picture. There's a lot more that's interesting at that level, but what we really wanted to do in providing this new tool, the Occupational Licensing Dashboard, is to get more granular, to talk about licensing at the state and occupation level, because we think that's often what's of most interest to stakeholders and anyone focused on these issues. So we were really motivated to highlight the prevalence of licensure across geography, across occupations, and across demographic categories. We wanted to allow users of the tool to explore labor market outcomes for different groups of workers. And so what we did is first to focus on the characteristics of licensed workers. So this is, for example, licensed electricians in Wisconsin. We can see in the tool, and we can find out a number of things about that group. And then secondly, to look at outcomes for all workers in a given state and occupation. So here we might look at all preschool and kindergarten teachers in Minnesota. And indeed, I'll walk you through that example in a moment. One thing I would note about the tool is that we don't actually limit it to occupations that you might think of as highly likely to be licensed. We really include all the occupations and states for which we believe we have sufficient sample size to report meaningful results. So you may find that this tool is useful for purposes other than simply looking at occupational licensure. So now what I want to do is just walk you through the tool. The occupational dashboard is on our website and available. And what I'll do is just walk through this example of preschool and kindergarten teachers. So I selected them and the drop-down menu at the top left, and I've clicked the state of Minnesota. And so what I see on the map to the left is the state level share of total licensed employment made up by preschool and kindergarten teachers who are licensed in different states. And then on the right, we have some tabs that allow you to unpack this further. So zooming in on that map, what we're showing you here is that share of total licensed employment made up by a particular occupation in a particular state, where darker states are those for which preschool and kindergarten teachers make up a higher share of total licensed employment. The map is helpful for making these easy comparisons across states. One thing to remember here is that this is all based on worker-reported data to the statistical agencies. It can make it a little messier than information from legal sources, but it allows us to connect licensure data with both workers' characteristics and labor market outcomes. And so some of those characteristics and outcomes I'm going to show you now. On the right of the tool, in the top tab, what I've highlighted here is just the number of licensed workers in Minnesota or in the country as a whole who are preschool and kindergarten teachers. We saw pretty substantial employment declines for this group, just as we did for childcare workers during the pandemic. We actually see the number of preschool and kindergarten teachers falling to just a bit over 250,000 nationwide, and much smaller than that, of course, in Minnesota. In this part of the tool, you can also look at the fraction of workers who report being licensed and track that over time. Just below this, under occupation characteristics, we have data that concern all workers, licensed or unlicensed, in the state and occupation. Again, it's set up so that you can make a comparison between a particular state and the country overall. What I've selected here is race, so you can see the racial distribution of preschool and kindergarten teachers in Minnesota, in the US. In Minnesota, 87% are white, by contrast to 65% in the country overall. And then another example of a characteristic that you can explore here is the foreign-born, native-born distinction. So this is quite relevant to our conversation that we're about to have today. So again, for this group of teachers, we're seeing that in Minnesota, that group is overwhelmingly native-born by contrast to the country overall, where about 88% of the teachers are native-born. And what this really does is allow me to segue into our principal focus of today's webinar, which is understanding these disparities in licensure for native and foreign-born workers and thinking through what might be done about those. So what I'd like to do now is pivot to that. I want to give you a higher level overview of immigrant licensure, economically speaking, followed by some of these new findings that we have about how licensure affects immigrants in the labor force. The first point I want to make is just that there are many immigrants who are licensed currently. About a third of them are in some kind of healthcare occupation. That's what you're seeing here, that immigrants who are licensed, are nearly a quarter of them are in healthcare practitioner occupations, with another group in healthcare support occupations. That does leave, however, about 2/3 of licensed immigrants in a variety of other occupations. But when you look at these data, what we quickly noticed is that there are these pretty substantial disparities, that foreign-born workers are considerably less likely to be licensed than native-born workers. And that's what you see in this graph. So the blue bar here is giving you the share of foreign-born workers within a particular educational group who report having a license. And that rate is lower than that of comparable native-born workers in each of these educational groups. The disparity is particularly large for those with more than a 4-year college degree. There are lots of potential reasons why these disparities might exist, and we think that requires some deeper research to disentangle, to understand if what we're seeing here is really an effect of licensing as opposed to some kind of confounder. But before I get into that, I want to take one quick detour into the larger economic literature on occupational licensing and its effects in the labor market. So this is work that folks outside our group have done recently in the academic community. And what they have found is that licensure is reducing employment. So what these researchers have done is to compare states that do and that don't license a particular occupation. So here they're not looking at, for example, physicians who are licensed in all 50 states, but they're looking at those occupations that are licensed in some states, but not others. One particularly nice recent paper looks right across state borders. So it identifies state borders where on the one side, the occupation is licensed, and on the other side, it's not. And what they see when they make that comparison is that employment in the occupation at hand is about 17 to 27% lower on the licensed side of the border. In other work that looks more broadly across the United States and compares all of the occupations, or all of the states that license an occupation to those that don't, you get slightly larger negative effects of licensing on employment. I won't have time to fully unpack this today, but what these papers are finding is that the effects run through labor supply. So licensing is making it more costly to enter the workplace. This could be fees, this could be the difficulty of navigating the licensure system, the cost of the training that's required. And those are some of the costs that sort of apply broadly. We know that there are extra costs, though, for particular groups. So folks who focus on licensing have looked carefully at criminal records and the role that they play in preventing access to licensing. They've also looked at special burdens that immigrants face as they attempt to obtain licensure. And that'll, of course, be our focus here. So what we did in our recent paper is try to do exactly that, to understand if the economic effects of licensing are different for foreign-born than for native-born workers. And what we found is that licensing is reducing foreign-born employment in a given state and occupation that's licensed by about 20% more than it does for native-born workers. And this is actually driving some substantial negative employment effects for Asian and Latino workers in particular. We also find that the wage premiums for licensed immigrants, so this is just the difference between the wages received by licensed immigrants and non-licensed immigrants after you control for what you can in the data. Those differences are bigger for foreign-born workers than they are for native-born workers. And we view that as consistent with this barrier to entry explanation, this labor supply account of what's going on. There's quite a bit more detail on the methods we employ, the results in this paper with my colleagues, Tyler Besch and Katie Lim. So to kind of restate the core finding, what we are seeing is that in states that license an occupation, the foreign-born share of employment in an occupation is lower than in states that don't license that same occupation. What we don't do in the paper is to fully explore what it is exactly that might be causing that effect. So is it language barriers? Is it the fact that credentials obtained abroad are not being fully acknowledged by licensing authorities here? It could be any one of a number of potential issues. And I'm really excited about our panel, in part because I am looking forward to hearing where that conversation goes and what folks are seeing on the ground as they work with folks who are seeking to become licensed. And so again, this work is up on our website. We would welcome you to have a look at that and to engage further with us on these issues. So please feel free to reach out to me personally. We have a variety of different research products up on our website, and would invite you to follow us on LinkedIn and Twitter as well. And with that, I want to turn things over to my colleague, Mary Hogan, who is going to moderate your next panel and in what I think will be a really fantastic discussion of all these issues that I've just been introducing. So thank you.
Wonderful. Thanks, Ryan. My name is Mary Hogan, and I'm a senior policy analyst in the Community Development and Engagement Division here at the Minneapolis Fed. In my role, I focus on labor market policy issues and where we look at how those policies impact low and moderate income workers. Like my colleagues, my views today are mine alone and not necessarily those of the Minneapolis Fed or the Federal Reserve System. As Ryan noted in his presentation, one of the areas of focus within our labor market policy portfolio is occupational licensing and foreign-born workers. Our researchers, as he noted, have found foreign-born workers have lower rates of licensure than comparable American-born workers. And as he also noted, there are several possible reasons for this disparity, including issues with a person's credentialing not being recognized or understood by state licensing authorities, language barriers, or issues with paying the required licensing fees, among others. These disparities matter because when workers are unable to fully use their talents in the US, they can end up in occupations that are a mismatch for their skills. You hear anecdotes like this for, say a person who is a surgeon in their home country whose credentialing doesn't transfer and as a result needs to drive Uber when they move here. Our conversation today will focus on the challenges that foreign-born workers experience in the labor market with state policies, including with things like licensing, but also get into what states are doing to address these obstacles to better utilize the needed skills that foreign-born workers are bringing. This is a timely conversation, for we know that workforce shortages are very real here in the 9th District. In Minnesota, for example, with our aging population, low birth rates, and negative total migration rates, thoughtful approaches are needed to address these workforce crises. Our panelists will help us walk through these difficult and important questions. And speaking of our panelists, I'm so thrilled that they're all able to join here today. I will introduce them briefly, but I would encourage you all to read their extremely impressive biographies found on the Minneapolis Fed website. We'll start with Rich Andre. Rich is the Director of State and Local Initiatives for the American Immigration Council, a nonprofit, nonpartisan organization aimed at making a more fair and just immigration system. Next, we have Hugh Cassidy. Hugh joins us from Kansas State University, where he's an associate professor of economics. He focuses much of his work on immigration and immigrant experiences in the labor market. Vina Iyer is the executive director of the Immigrant Law Center of Minnesota, a nonprofit agency that provides immigration legal assistance to low-income immigrants and refugees in Minnesota and North Dakota. And last but certainly not least, we're joined by Abdi Wahab Mohammed, who's the Assistant Commissioner for Immigrant and Refugee Affairs at the Minnesota Department of Employment and Economic Development. I will have questions for our panelists, but I also know that we have a lot of expertise in the audience. So I would encourage you to post your questions in the chat, and I will do my best to incorporate them as we go along here. So starting with you, Hugh, just to kind of set things up. You know, Hugh, as noted, a lot of your research has been related to immigration, including work on occupational licensing in immigrants, immigrant employment more generally, and language acquisition and occupational characteristics. So as we begin this conversation, can you talk about the state of foreign-born workers in the labor market more generally? You know, who are these workers that are coming, and what does their labor market participation look like?
Sure. So I want to start by thanking Mary and Ryan in particular, and anyone else involved in setting up this panel. I know it's a huge amount of work, and the exactly 100 participants. Thank you for joining us. It's a good number. Let's stay there. No one leave. So as Mary said, I'm a associate professor at Kansas State University, focusing primarily on labor economics and immigration. So just give you a few minutes, a very, very high level overview of immigrants in the labor force. We could talk about this for many, many years if we wanted to. So this is going to be very, very brief. Most of you will know most of this information, but just so we're all kind of on the same page with the high level stuff. U.S. immigration historically to the U.S. has been European until the 1920s, where immigration shut down substantially, and they picked back up substantially after the immigration reform in the late 1960s, and from afterwards we saw a substantial increase in immigration, but also a change in the source country of immigrants. And that's something I'm going to emphasize a few times, especially as it relates to licensing, to just about everything about immigrants in the labor force. Since the late 1960s, early 1970s, immigration has been disproportionately Latin American and primarily Mexican, or largely Mexican. In more recent years, we've seen large increases in immigration from India and China as well as a change in source country, a lot more African immigration as well. So we see it's constantly changing, but Mexico remains the largest source of immigrants to the U.S., and India and China kind of second and third for the most part. So what do these immigrants look like? Well, in terms of education, immigrants to the U.S. are much more dispersed in terms of their educational attainment than native-born workers. So what I mean by that is they're much more likely to have less than a high school degree. They're also much more likely to have a graduate degree and professional degree. And so you see them more at the tails of the distribution, whereas native-born workers tend to be distributed more towards the middle. This is closely related to their country of origin as well, and what selection pressures go into immigration and the legal mechanism by which they immigrate. Immigrants from India and China are disproportionately employment-based immigrants, and often people have come for schooling and stayed on through various visas, and so they tend to be much more educated than immigrants from primarily Latin America and Mexico in particular. We also see that, and this is just one human capital characteristics, but it's one that I'm going to emphasize again a few times: English proficiency. it's important. It's important for the labor market in general. I think we'll talk more detail later. I think it's particularly important for licensing. And that's also something you see a lot of variation by country of origin. Very high levels of English proficiency amongst immigrants from India, and very low levels of proficiency among immigrants from Mexico. And so you can imagine, it's not difficult to imagine that a lack of English proficiency might really matter in a number of dimensions in the labor force, but in particular, trying to get an occupational license. In terms of labor force participation, what we see a pattern that's persisted for several decades. COVID interrupted a little bit, but it got back to its pre-COVID pattern very quickly, is that immigrant men, especially undocumented immigrant men, have very high levels of labor force participation, followed by legal immigrant men, followed by native-born men, so non-immigrant men. In general, they all have high labor force participations, but that's kind of the ordering we've seen for quite some time. During COVID, they kind of compressed a lot. Immigrants lost their employment, dropped substantially. I have a paper actually about that, but it recovered very quickly afterwards. For women, we actually see the opposite pattern. We see that native-born women have the highest labor force participation, followed by legal immigrant women, followed by undocumented women. So you see the reverse pattern among women. Legal status really matters in a number of dimensions, but of course matters for labor force participation, and almost certainly for acquiring a licensing as well. So the title of this event is Addressing Obstacles to Opportunity for Foreign-Born Workers. One kind of way, there's a lot of ways you could try to address this. It's a tricky questions to answer, but I'm going to give you one kind of statistic, not exact numbers, but to give you a sense for how these barriers might really be present, that they're actually there. If you look at the educational requirement of an occupation, and forgetting how that's measured, but let's leave that aside, immigrants, some US born, some immigrants tend to be in occupations that require less education than they actually have. We call them overeducated. There's a number of reasons for that. But what we see is that immigrants are, especially immigrants from India and China, these disproportionately employment-based immigrants, are much more likely to be overeducated. And again, there could be a number of reasons for that, how you transfer credentials, maybe the credentials aren't equivalent, that's possible. But it's also consistent with the story that these immigrants are just not able to get into the occupations where their education would be most used. And so this is just one piece of information, but to give you a hint that barriers and obstacles are really there, and therefore there could be progress made to address those and reduce or hopefully eliminate those barriers. So that's all I have to say. I mean, I know that's a lot of very, very quick information, but yeah, so.
Wonderful. Thanks for setting the stage. And, like you said, I think all of us who are here could talk about this issue for a long time. So I appreciate you condensing it as best you could. One thing I just want to note before we turn it over to Rich for his question is I misspoke earlier when I said, put questions in the Zoom chat. Apparently it's called the Zoom Q&A. So I apologize on any confusion I might have caused there. So Rich, turning it to you, in your role at the American Immigration Council, you co-facilitate the Office of New Americans State Network. Minnesota is part of this network, as is North Dakota and other states along the geographic and political spectrum here. Can you tell us about the ONA network and what it's trying to do?
Sure. Thanks, Mary, for the question and for the invitation to join you today. So as Mary mentioned, I'm the Director of State and Local Initiatives at the American Immigration Council. I'll give you a quick background on our team, which is our State and Local Initiatives team was founded about 10 years ago to work with government, nonprofit, and business leaders to leverage data, not only data that we produce in-house, but also from partners across the country, so they can better understand their immigrant refugee population, and also what they bring to the table demographically and economically. And so now our team works in about 100 communities across the country and nearly 40 states. And we've actually done quite a bit of work in Minnesota and a little bit in North Dakota. And I'm very happy to be here with the Fed and also other partners on the call. So Mary, you asked about the Office of New American State Network. I'll refer to it as the ONA network because it's a mouthful. But as you mentioned, we co-convene the network with our partners at West Global Talent Bridge. So I'll tell you a little bit about the network, who participates, what it's trying to do, and kind of how it ties into this issue that we're discussing today. So the network consists of 19 states, all of which have a dedicated Office of New Americans or Immigrant Affairs, or in some cases, a senior policy advisor, usually based in the governor's office. And all these offices or policy folks kind of have a common thread of addressing barriers to integration for immigrant and refugee communities, not only into the economy of those states, but also at the local level as well. And each of their kind of focus areas is different. Some focus on language access, others on coordinating legal services and benefits. But one of the through lines, I would say, across the whole network and all the states that participate is this issue of addressing barriers to employment, particularly for foreign trained professionals. And I would put addressing barriers to licensure as part of that portfolio. So who makes up the network? We have a huge diversity of states. It's states that you might expect with the largest immigrant populations, places like New York, California, and Illinois, but then also places that are seeing their immigrant population grow, particularly over the last 10 or 20 years. And I'd put Minnesota in that bucket, Utah, and most recently North Dakota. And it's been really interesting working on this portfolio for the past few years because we've seen tremendous momentum behind these types of offices. When we started co-convening the network in 2019, there were 6 offices. And like I said, we're now at 19 and likely heading to 20 and maybe a few more by next year. It's also worth noting that this network is bipartisan. I emphasize that because so much of the immigration debate at a federal level is hyper-partisan. And what we're seeing is there's a lot of common ground on these issues, particularly through a workforce lens at the state level. And just to drive that point home, one of the kind of founding offices, which was the Michigan Office of New Americans, now known as the Office of Global Michigan, was actually founded by a Republican governor, Rick Snyder, in 2014. And I think of them as kind of the godfather of the network because they've done so much mentorship for other states as they've come on board. Just in the past few years, though, we've seen North Dakota, Utah, as other examples of ONAs with Republican governors. So there is a middle on this issue. And I think the ONA network in many ways exemplifies that middle. I wanted to speak really briefly about the different models that exist, because like I said, there's quite a bit of diversity among and between states. So, and that ranges from how these offices are created, either through executive order or legislation. Again, to the point of bipartisanship, most of the bills creating offices of New Americans tend to be bipartisan in nature. There's diversity in where they're housed. So some offices are solidly in the governor's office. Some are in state agencies, like the Department of Human Services, an example of New Jersey, or the Department of Employment and Economic Development in the case of Minnesota. But if you kind of take how they're created and what language dictates their mandate and then where they're housed, you start getting a picture of what their scope of work is. And like I said, a lot of them do have a workforce lens explicitly or implicitly. And I should mention that these offices are not tasked with doing all the work of immigrant and refugee inclusion, right? They're just, a lot of them are offices of 1 or 2 or maybe 10 in some cases, but they're small outfits. But what they do is start thinking about the unique barriers that immigrants face when accessing information or programs or benefits or employment. And then they kind of put those issues on the radar of other state agencies and other community partners. So they are a little bit of like the immigration experts, but also the kind of hub of, you know, what barriers exist and what are some possible solutions. And so they do a lot of coordination and honestly providing statewide leadership on this issue. So where do we come in? So the American Immigration Council and WES co-convene the network, and that basically means we almost serve as like the back office staff for all of these very talented and impressive policy folks across the country. And so we provide technical assistance. My organization in particular produces a lot of tailored research, again, to help quantify the economic and demographic contributions of immigrants at the state level. We create opportunities for members of the network to liaise with federal partners and make sure that their kind of state-specific priorities and obstacles are being elevated to their counterparts in Washington. But I would say most of all, the value that we add is really creating space for them to talk to each other and we get out of the way. Because the folks who staff these offices are so knowledgeable. A lot of them bring quite a bit of expertise, both personal and professional, to the network. But they're also so generous with their time. And so we see a lot of peer mentorship and sharing best practices. And to be frank, troubleshooting common challenges in real time. And so as you all can imagine, top of mind for a lot of these offices is new arrivals arriving into the interior from the southern border. And as states are trying to figure out how do you respond to this issue, how do you make sure folks are connected to resources, they're doing a lot of that in these spaces that WES and AIC help curate. So I'll kind of leave it there. I mean, workforce absolutely is one of the top priorities for a lot of these offices, and they're doing a lot of great work in the space that I hope I can share a little bit later. So let me turn it back over to you, Mary.
Thank you so much. Veena, turning it to you, you're the executive director of the Immigrant Law Center in Minnesota, which serves immigrants and refugees with a wide range of issues here in Minnesota and now in Fargo, North Dakota. Can you tell us about the foreign-born population here in Minnesota and North Dakota, and what types of challenges you're seeing with documented immigrants in the labor market? Since that's the scope of our conversation today, I asked the question knowing that there are very real challenges with both undocumented and documented immigrants' experience, but kind of just honing in on the topic. If you could shed some light, that'd be great.
So thanks so much to Mary and to the Federal Reserve here in Minneapolis for having me today. I'm actually going to start a little bit off of what Hugh shared a little bit about history, having been a history major as an undergrad. The first thing I'll say that's I think kind of interesting for a lot of folks is to know that right now that for Minnesota and North Dakota, yes, both states are experiencing a surge in immigration. But what's interesting is this is actually kind of average, maybe a little bit less than average when you compare it to our history. If you look about 100 years ago, what's interesting is that, for example, North Dakota had the highest percentage of foreign-born residents in the entire nation. Similarly, for Minnesota, a very large population of immigrants at that time as well. So I think one thing very important in this moment is for folks to understand that yes, increases relative to our recent past, but certainly not to the history of our nation or the history of our states. With that said, for a few more details for each state. So here in Minnesota, about 8% of the state's population is foreign-born. It's smaller. In North Dakota, in Minnesota, about 75% of foreign-born residents are working. And one thing that's also really important to know is that we're working and we're seeing so many folks who are actually mixed status families. So a lot of children who are U.S. citizens, lawful permanent residents, spouses, who have parents who are immigrants as well. So really, it's very hard to separate immigrants from non-immigrants. Frankly, they're all parts of the same families, parts of the same communities. And then especially here in Minnesota, and really, I think increasing in North Dakota as well. But here in Minnesota, immigrants play an outsized role in our labor force. 81% of the foreign-born population is working age 18 to 64, according to a recent study by the Chamber of Commerce, while only 60% of the native-born population belongs in this age group. And that's just that difference is just increasing precipitously with time. The other thing I think that's also really important to note about our communities is that both in Minnesota and North Dakota, the increase in immigrant populations is not just a urban phenomena. I think that's something that a lot of people think is that it's just, for example, for those of you, I know this is a national group, you're probably very familiar with, or maybe somewhat familiar with the cities of Minneapolis and St. Paul, which is our biggest population center in Minneapolis. But frankly, the cities with some of the highest percentage of immigrants in Minnesota is in greater Minnesota. For example, Worthington, Minnesota, in the southwest corner of our state. Austin, Minnesota, which as a Texan is always been odd to me that Minnesota has an Austin, but it's the home of Hormel, and it has a very, very large immigrant population as well. So I think anywhere you look in the United States, that you can't just look to the urban centers. Immigrants are really powering our rural communities as well. And then as far as the type of issues that folks are facing, particularly, I think, on the side of documented workers, there's a couple of things I would say. First, just overall, big delays in application processing, which have made it so that, especially, I would say for people who are on the road to documented status, which is really important because they're the people who are then going to have work authorization, who can take a number of these jobs. Those processing times are getting longer and longer and longer. Times that were a couple of years are now 5 years, both because of the pandemic and because of the lack of resources with USCIS. So what does that mean? That means that there are people who could be members of our workforce in our communities that just aren't getting the status that they will get as soon as they get, through the line to be able to be a part of our economy. The second, more particularly, delays in processing renewals of employment authorization. There have been some stopgap measures to do some extensions of those, but that's the number of folks who call us so stressed out because their employer wants them to keep working. They want to keep working, but they sent in their extension for an employment authorization card several months ago and haven't gotten it, and are worried that they might get laid off. Another issue that we also see, and this is also across the country, is there's been some discussion about folks who come in on employment-based visas, which are great, but some of those folks come in with dependents who are highly educated. Some of them can get work authorization, some of them can't. So we have a population of people here who are so well educated and could participate in our economy and can't because they are dependent visa holders that don't get employment authorization incident to status. So those are a couple of the things. Just overall, we'll be talking about, of course, the licensing issues more specifically in a bit, but those are some of the problems that people, I think, that documented immigrant communities are facing, especially now, and also with, I think, the arrival of, there's Ukrainians, Afghans, they have status, they have employment authorization, but some of our laws and things haven't caught up to that. They're used to the traditional statuses of of citizen, green card holder, and some have at least got your refugee and somebody who has asylum. They're not used to people who have humanitarian parole. They aren't used to people who are in the Ukrainian program. And so that's one of the problems too, is you've got people with work authorization, but some of these occupational licensing kind of categories of immigration status don't catch up with them.
That's super helpful. Thanks, Vina. So then turning to you, Assistant Commissioner. So we mentioned, the Office for New Americans now has permanent funding here in Minnesota, which is great. Rich gave a helpful overview of the ONA network's goals and priorities. Can you tell us more about how Minnesota's Office for New Americans might fit into the broader goals for the network?
Yes, thank you, Mary, for the question and also for having me on the panel. As Rich has mentioned, the Office of New Americans network is about close to 20, and Minnesota is one. And for about 3 years right now, the office was funded through a foundation support temporarily. And then, of course, in the last legislative session, the Office of New Americans funding and its establishment passed through legislation, and the governor signed it. And now we have an office that is funded to support the immigrant and refugee communities in Minnesota. We have used a lot of resources. Rich is very humble on what has done, but has been so much supportive of getting this office and supporting the work that we do. Just as an example, in the last, when this office was running on that foundation support, we have supported over 300 employees being retained through the actual outreach that we have been doing, working with career force centers across the state, working with employers to do cultural orientations. We have convened over 13 state agencies to align budget ideas as we were approaching the legislative session, and we have done so much work that thanks to the my predecessors who are in this office. And so when we are part of the network, we go, we share information, we talk to each other, we share best practices from across the states, and that's what we bring home to share that as policy updates. But continuing on the office, we've seen that when the articles for passing this office was being discussed, and Vina was part of all the teams that were also stakeholders, we looked at what are the major trends in the state. And, Minnesota, as has been mentioned, is about 8.5% of the population is foreign born, about close to 500,000. And we've seen that also our dynamics are changing. I was looking at some data from DEED. Over 36,000 people moved out of state, and over 22,000 people replaced net international immigration into our state. And that means that the labor force is changing. A lot of the labor force growth was led by immigrants who come to the state. So employment and workforce and credentialing is so important that it's one of the core activities that this office will do. And that's not about it. So we have other functions that this office will do that we'll talk about as well. But that was one key reason why this office was placed within the Department of Employment and Economic Development. As Rich mentioned, offices are created in different ways. And we mostly don't have a lot of services that we provide or grants that we give, but we advise and we convene. The way we see Minnesota as that, the state enterprise has a lot of resources through its agencies. The One Minnesota budget included, anything from starting and safe and affordable housing. It included healthcare. It included schools and childcare, adult education, employment and workforce and economic development, and all that is done by agencies. So there is a lot of resources, but the idea of getting that resource to the community is one thing that's always sticks out. So ONA and Office of New American in Minnesota is seen as the convener, sort of a two-way information sharing, as you might call it, that we will liaise with the agencies and will bring together an interagency council that the Office of New Americans will chair, and that will advise policy and how to best serve these communities and the immigrant and refugee communities, and what are the issues that we should be focusing on. And on the other side, too, this office will work with the communities, the partners, the community organizations that now will connect us with the immigrant and refugee communities, so we can learn the barriers that they face and then turn that into advice and policy. So that's the major kind of role that the ONA plays here as far as the immigrant and refugee communities are concerned. So we mostly liaise with state agencies, and we have so many of those programs that we complement that the agencies are doing, to serve a whole community. It's not just an Office of New Americans that can serve. So we play that role, working with our partners, both in the state, the ethnic councils, and of course our stakeholders in the community, to bring these services closer to the New Americans. Now, we have a lot of barriers that we will be going into, hopefully, into the next part of the session, but that's what basically the office does and how the office should be seen as serving the communities.
Wonderful, thank you. So turning it to you, Rich, since we just heard about what this will look like here in Minnesota potentially, curious about, on a broader level, what are you noticing with the trends of state action more recently? What's been surprising to you? What are some good examples of things that are working that different states are trying?
Sure, it's a great question. I think my first takeaway has been that states are becoming increasingly active on immigrant-related legislation in particular. I think it's impossible to decouple that from the fact that Congress hasn't passed immigration reform at a federal level in however many decades. And so I think states are feeling like if the federal government's not going to do it, we need to do our part. To share a number with you, our team does some pretty extensive legislative tracking, and we tracked over 1,000 immigration-related bills this year alone across all 50 states. So it's definitely something that we're seeing those numbers tick up, and different states recognize that, as they're crafting their economic development strategy or workforce development strategy, kind of immigration has to be a part of it, but they're also recognizing on the flip side that there are these unique barriers. I will say that, some states are taking a more restrictive approach to this issue, and I'm not going to name names. I think you know who they are, but many more states are looking to reduce barriers to inclusion and access. And so I think there's a couple different types of bills that we've seen pop up and increase in number. One, going back to the conversation we were just having, is bills creating offices of New Americans. So we talked about the permanent funding for Minnesota's office, which we were thrilled to see. But just in the last 3 years, we've seen offices get stood up through legislation in Colorado, Maryland, North Dakota, Oregon, along with several others that have been created through executive order. So like I said, there's a lot of momentum behind these kind of investments in state level infrastructure to support immigrant and refugee communities. I think another bucket that we're seeing a lot of movement on is in-state tuition, especially for Dreamers. Some of you may have kind of followed the the ballot measure in Arizona last year, Prop 308, which thankfully passed. And I think there's a lot of states that are recognizing that, if you have folks who are growing up in your community, attending public schools, and then hit this barrier when they want to go to college and access in-state tuition, that's to no one's benefit. So we're seeing a lot of movement there. But more germane to this conversation, I think there's been a lot of movement on workforce-specific legislation and programs. And I think that comes from two angles. One is the fact that unemployment rates are very low across the country and the employers are struggling to find workers. And also that these types of bills tend to be bipartisan. And so you can get them out of legislatures in all different parts of the country. On the workforce piece, there was a great report that came out from the Migration Policy Institute a few years ago that found that nationally there's about 2 million, work authorized, college educated immigrants who are either underemployed or unemployed. So back to the example you gave, Mary, it's the architect working as a taxi driver, for example. And we're seeing a lot of states not quite jump in with 2 feet on legislation, but choose to pass bills to basically study the issue and how it's manifesting in their state. So Georgia and Arizona are 2 that passed bills recently, basically creating workforce studies. So they're convening partners from all different sectors to look at what are these unique barriers to employment in our specific state. And almost all of them are identifying licensure as one of the main barriers. The other one is around healthcare shortages. And so other folks on the call mentioned that, we're seeing shortages in the healthcare field across the country. And so states like Colorado and Washington have passed bills to better integrate what we call international medical graduates, basically physicians who receive their training outside of the United States, to help connect them to jobs in their field. I'll just give a quick plug to some of our work in this space, because as I mentioned, we do have pretty substantial tracking capability, and we're always updating different partners on bills that are popping up in their state. So if there's folks on this call who are interested in tracking bills on this issue, I'm sure the Fed is a great resource, and we can be as well. We also put together research that helps kind of quantify the impact of a specific legislation. So for example, the in-state tuition fight in Arizona, we were able to show what that economic benefit would be if that bill were to pass. We do compile best practices similar to what we do with the Office of New American State Network. States are always looking at things that other states have already done. So we do a little bit of that kind of documenting and compiling. And then as the Assistant Commissioner can attest to, we do also testimony and letters of support for bills, especially articulating kind of a workforce or economic focus. So that's a little bit of what we're seeing. It's a lot of ONA, in-state tuition, and then workforce related bills. And I think we're gearing up for maybe an even more active 2024 legislative session. So we're kind of strapping in.
Thanks for that, Rich. So Hugh, Rich just kind of touched on how licensing can be a barrier in the workforce space for immigrants. And, we heard about the Fed's research from Ryan's presentation that he did before this panel discussion. I'm curious, from your work, what have you seen in the existing ways that licensing can be a barrier for immigrants or workers?
Right. So I guess to start, licensing is a barrier for immigrants in many ways, the same ways that it's a barrier for non-immigrants. And somewhat cynically, it seems to be almost largely intentional. You keep workers out regardless of why. it's kind of meant to be a barrier, and that's sometimes okay. And it can depends on who you ask, I suppose. But so it's a barrier for immigrants and natives in very similar ways. Occupational choice, it's a barrier to mobility. Ryan had mentioned, alluded to a couple papers that I've looked at occupational mobility. Morris Kleiner has an enormous amount of work. He's at the University of Minnesota, by the way. So that licensing inhibits mobility across states. It also affects endogenously, to use an economics term, it affects what you're going to do. And so to use the example, building off of what Rich was saying about like Arizona, for example, recognizing licensing credentials. More recently, Kansas State University is right next door to Fort Riley, a large Army base. Well, I know a lot of friends who are military, a lot of spouses, disproportionately women, are coming in and they can't work. I mean, or they can't work necessarily in the jobs that they would want to. But then you take a step back and say, well, if I know my husband's going to be traveling to different states and I'm going to relocate, maybe I'm not going to invest in being a nurse or a teacher or something that would face difficulties in getting recognition in the state that I don't know where I'm going to be in a year or 2 years. And so it affects not just how difficult it is to get an occupation, but affects everything before. What are you going to choose to do? Also in other ways that are interesting. And Ryan had also mentioned papers looking at licensing, some of the positives of it's a way to signal things about yourself, right? So there's this other dimension that if you're in a demographic group that is much more likely to have, let's say, a criminal record, you can signal that you don't by having a license, for example. There's evidence suggesting that that's quite important. Or maybe if you're an immigrant, you can signal maybe your educational credentials don't transfer very well, or employers don't know how to evaluate those, but they can evaluate your license. And so that's another kind of in the opposite direction that actually helps immigrants potentially. I mean, these are empirical questions whether it balances or not, but there's a lot of things going on. So to kind of answer, so there's licensing is a barrier for everybody in some sense, but to get more specific about, I guess, to answer a somewhat different question, what is making immigrants harder to get a license? Again, there's many answers to that question. And from my perspective, I'm not a legal expert. I don't know kind of the law about all these specific, I mean, there's thousands of different licenses of states and so forth. But what I see in the data is that language ability matters, right? Language ability matters pretty significantly. I see evidence of that overall, that immigrants who lack language ability, English language ability, of course, are quite a bit less likely to have a license. You also see evidence from that from other researchers, one particularly well-known one in the field that studies Vietnamese manicurists. And in some states require an exam in English. Some states don't require an exam. Some states will require an exam, but provide it in Vietnamese and other languages. Some allow you to have a translator. And so you see that it has a de facto requirement to be a manicurist to get this license. So in states that don't have this de facto English requirement, Vietnamese immigrants are more likely to be manicurists in those states. And so that's kind of direct evidence that that lack of language proficiency matters for immigration. There's also this, if you think about, it may not be so obvious, but a lot of licensing requirements, and again, maybe to be cynical, don't know why people are doing things necessarily, you can speculate, but are going to have disparate effects on immigrants versus natives. To use one very specific example, DC recently changed the requirements for childcare workers. I think this was under challenge or is delayed, so don't quote me on exactly the status of it right now, but there was at least proposed or is meant to be enacted of requiring childcare workers to have a college degree, which maybe that's a good idea. I don't know how you could defend that, but fine, okay, but who's that going to affect most? Who are childcare workers in largely immigrant-heavy areas? They're almost all immigrants, and in fact, you look at economic evidence of female labor force participation among non-immigrants. It's higher when you have a large source of immigrants who can provide cheaper childcare. And so, what is this effect going to have? Whether it's their intention or not is, I guess, immaterial. If you make childcare workers have to have a college degree, that's going to affect immigrants more. Even if the word immigrant doesn't appear anywhere in there, it's going to affect immigrants more. And so these barriers, sometimes they are direct, like requiring a citizenship or permanent residency, which my layman's understanding is of questionable legality, but I won't comment more on that. Other than to say on the books, it says you must be a citizen. So whether it's legal or not, that's likely going to have an effect. And I find evidence that being a citizen does, not surprisingly, increase your probability of being a licensed citizens, and there's a selection bias issue there. But there are restrictions that are going to affect immigrants more than non-immigrants, such as, for example, requiring childcare workers to have a college degree. in DC. In terms of, well, one thing I want to really emphasize, and I emphasize this in my opening kind of discussion, but I want to point out is just how much heterogeneity there is, how much difference there is by country of origin in particular, but also between men and women. That's something that I think really needs to be emphasized. If you look at different countries of origin and where immigrants come from, especially between men versus women, you have immigrants from some countries, they just look very different, right? So less educated workers in general are less likely to have a license. Immigrants from Mexico have, on average, very low levels of education. So it's not surprising that they're going to have low licensing rates. Even controlling for all those things and adjusting for all that stuff, you see some regions where immigrants are very under licensed relative to what they should be, given their other characteristics. But you also have some regions where they're very over licensed, very interestingly. And in particular, female immigrants from the Caribbean, Southeast Asia, disproportionately Philippines, and Africa are much more licensed than you would expect, given their characteristics. And that's almost entirely nursing, right? And so partly I want to point that out as a particular example, but also just emphasize just how much heterogeneity there's by country of origin, how much heterogeneity is by education level, how much heterogeneity there's by men versus women at different education levels. You see the gap between licensing for women, it's actually not that significant until you get to the highest level of education, and then it really explodes. For men, the immigrant native licensing gap is bigger than for women. So men are male immigrants seem to be more severely affected by these challenges that immigrants have in getting a license than women do. They're both less likely to be licensed, but for men, it's particularly large. And for men, you see that gap across the educational distribution. Men with a high school graduate degree or lower, our immigrants are very unlikely to be licensed. What types of jobs are these native workers doing, native born workers doing in this educational distribution? Well, jobs like an electrician. I mean, become an electrician is very difficult. It takes many thousands of hours of apprenticeship work. You need to find somebody to be your apprentice. And so these are barriers that if you come to the US age of 30, you're 30 years old, but you're kind of like an 18-year-old in that you're just entering the labor force. And so if it's very difficult to get a license for anybody, immigrants are arriving later on average because they're arriving, they're really, once they come to the US, they kind of, in many ways, are more resembling new labor force entrants than they are native workers of the same age. Well, if you're 35 years old, is it worth spending years getting a license when you're that much closer to retirement, right? So again, even if the word immigrant doesn't appear in any of these requirements, it's going to have a disparate effect on immigrants versus natives. That's not necessarily a bad thing if we want electricians to have X number of hours, but that's something worth keeping in mind that, I believe the US recently changed the number of hours pilots require for licensing, much different than Europe. And it's like, well, we don't want to cut the number of hours for pilots, right? How dare you? It's like, well, Europe has half the number of hours required, and yet their safety rates seem to be about the same. And so you got to think like an economist and think like, what are the costs and benefits? And then furthermore, what are the costs going to be for immigrants relative to non-immigrants? And in a lot of these requirements are going to affect immigrants more severely than non-immigrants, even if it isn't specific to immigrant or citizen or language or anything like that. So, and then finally, to end up, legal status obviously matters a lot. I mean, if you can't validate your legal status, if you can't, as Vina was saying, these kind of very unusual in a statistical sense. People don't know what the Ukrainians, whatever. I don't know. I mean, I don't know what that is. You can't blame them for not having this information necessarily. And you don't want an employer to say, I don't know if you qualify for this. And so how do you solve that? Information, I guess, solves that. But it's still a barrier. And it's obvious. In that case, that's very specifically an immigrant related barrier. But these barriers exist for immigrants, even if it doesn't say immigrant on the requirement or the regulation or the law.
That makes sense. I wanted to throw out a question that we got in the chat that I thought was interesting, and I'm not sure who among you is the right person to answer it, so I will leave you to determine it. But the question says, I'm curious as to whether eliminating licensing would make it easier for an immigrant to navigate through. Oh, wait, see, I read the wrong question. I'm sorry. Hold on a second. Okay. Here we go. Can the panelists talk about how licensure plays into occupational segregation, particularly healthcare, where new Americans comprise a significant portion of direct care jobs, but not in advanced practice roles? Vina looks like she's nodding. I'm going to turn it to you, Vina.
I mean, I'm nodding. I think it's true, and I think it's and that might be a segue into the other things I was going to talk about, but you know, it just goes back to this issue, right? Of you have it goes back to Mary's example of the doctor from Nigeria who is now an Uber driver here. Well, there's the Uber driver, but there's also that he is a personal care assistant working in a long-term care facility, etc., where his tremendous knowledge of medical issues is a great boon to that organization. And he's bringing a ton of skills that he's probably not being paid for in that position. But I think that's exactly right. But it comes to these questions of when it's takes a lot of time to have to study for, you know, all of the different license, you know, the licensing requirements for the exams, etc. Also, and you know, I'm actually going to throw in here, the doctor example is a great one. And I just want to do a shout out to the people who are on the call from the International Institute of Minnesota, which is a great organization here and helps to provide support for a program that was mentioned earlier, the International Medical Graduate Program here in Minnesota, which provides a supportive pathway for international medical graduates who are here in Minnesota to get some of the, to be able to take the USMLE test, to get the, get some of the, you know, kind of observation hours, et cetera, to then get into a residency program. It's fantastic. But for that, they've got, just as a lot of places have, difficulty finding enough people who can supervise observation hours, can bring people in when we have such a shortage. So it's hard to do that, hard to get folks, you know, in there. And then, of course, there's the issue of the limited number of residency spots that's available in the U.S. writ large, whether you're talking about foreign medical graduates or U.S. medical graduates. And finally, that program has this issue that it's only, the only people who are eligible are citizens and lawful permanent residents, not other types of immigrants who have employment authorization, or other types of immigrants who might get employment authorization pretty quickly. So you've got all of those problems that lead to, I think, exactly what the observer said. I don't have, those are the data people. I'm like the anecdote person on everything except for statutes. But I think anecdotally, that's what we see is a lot of people, that's why there are folks who are in certain positions, and there is that kind of occupational segregation that's happening because it's too hard to jump up to the next level in our current system.
Thanks, Veena. Anyone else want to touch on that?
This is Abdul here. So this is one of the issues that from the last legislative session, we have looked at and said, this is an industry that really is, you know, struggling with finding employees for these for the sector, and especially into the, you know, lower spectrum of the long-term care. And so there was some funding that was allocated for these specialized services for new Americans into the long-term care. And currently our Department of Human Services has an RFI, a request for information out there, reaching out to organizations that are doing this and are serving new Americans in the long-term care to know what are the best practices, what has worked well, and probably, you know, turn that into a request for proposals and help to address the barriers that are in that area, and of course the segregation that are in that area in terms of the funding that we've received. It's about $28 million for the next 4 to 7 years, I think. That's a huge chunk of money that can make an impact into this into the long-term care. So I just wanted to put it out there, and that we will rely on your information as well to make this industry and long-term care more you know, welcoming to the new Americans.
I could jump in very quickly as well. So partly, I think licensing plays a huge role in why you have, to simplify things, a lot of immigrant nurses, and you actually have a lot of immigrant doctors as well, but not, relatively speaking, more nurses. It's just easier to become a nurse and to move to the U.S. as a nurse. I use the example, if you look at immigrants from African countries, Caribbean countries, and Philippines, they are very, very likely to be nurses. And part of that is that the training done in those countries is targeted to make you a nurse in America. And they know how to do it, and they know what the legal procedures is. It's attainable. Clearly it's attainable because many have attained it. And so there's kind of a channel by which immigrants arrive from these countries. And then furthermore, and I'm speculating here about degrees, once you have, why are Vietnamese disproportionately manicurists, to continue that example? Well, partly it's cultural, maybe, I don't know. Partly it's that immigrants tend to cluster in occupations by ethnicity. That's a phenomenon that goes back for centuries. But in terms of licensing, and it's probably more significant. Again, I might be wrong there. It's worth actually an interesting question to look at the data. It's hard to get a license, even the simplest license. I'm kind of baffled looking at requirements and kind of scratching my head. But once you know your cousin's done it and your aunt's done it or your brothers or whatever, it's just easier. It's easier when you know, have friends who have navigated the process, and family and community members have navigated the process. That's both at a neighborhood level and a country level as well. And so to summarize, it's just easier to become a nurse than it is a doctor in the US. And that means there are going to be more immigrant nurses, and that's directly tied to the licensing requirements and difficulty in transferability.
That's a good point. Veena, I think we touched on this already, but I want to turn it back to you just to see if there's anything you want to add, from a legal perspective. Hugh touched on the economic pieces with barriers that licensing can be for foreign-born workers. I'm curious, from a legal perspective, what are some of the barriers that you're seeing?
Yeah, and thank you so much. And I think that Hugh's teed it up really well, because I think what he talked about parallels exactly what's happening, which is you've got one part, which is just restrictions based on immigration status. But then you have this issue of burdens that disproportionately fall on immigrants that are legal requirements, and then those that are just a problem for everybody. So just going into those a little bit. So first you have, restrictions or opening up of licensing more broadly. So you've certainly got a lot of places across the country, including Minnesota, for example, with that International Medical Graduates Program, that have certain immigration statuses that are listed that you can get a license versus you can't. Agreed with Hugh that there's some questions about, I think, the legality of that based on the Equal Protection Clause to a certain extent. It depends on which statuses. But yes, there are some that are limited, and it's hard to tell. There's some states where it's just across the board, because they've just said, no, we're not going to have certain immigrants in any type of licensed occupation. Others, it's very occupation specific. Next, you on the other side of the spectrum have states that have said, absolutely not. We don't want immigration status to affect who we license. So those are states like California, Colorado, Delaware, Illinois, Nevada, New Jersey, New Mexico, and Oregon. All of them have passed laws that indicate that for all or most professional licenses within the state, they will grant them regardless of immigration status. So it's a wide variety on that piece. One thing I think that's important about that is just thinking about, and I'll talk about it a little bit more when we talk about solutions, is it immigration status that we're really trying to get at? I mean, one of the problems I think here is that immigration status can sometimes be a proxy for work authorization, and a very inaccurate one. And so that's something that I think can be a problem with some of these laws. The second is this issue of licensing requirements that disproportionately burden immigrants. And English, I agree with you, as an example, and a really good example that I became aware of very recently from my friends at the International Institute, is for nursing here in Minnesota, the English, that you have to pass an English test unless you went to nursing school in a certain list of countries that are English speaking. English-speaking countries, among them are, of course, England, Canada, some of the Caribbean countries. But for example, countries where the vast majority of people's education is oftentimes in English, for example, India, the Philippines, others are not on that list. Like, there's no way to say, I was educated in, in English and all of this stuff. I used it in all of my work, and so therefore I don't have to take the test. And so I think that there's other examples of that. And then, of course, there's just the overall difficulty of certain professions. One of the things is obviously we have a higher number of physician's assistants nowadays here in the United States, but limited ability of people who come with a medical degree to get to be a physician assistant, because you have to graduate from an accredited program here in the United States. So certainly maybe some of your classes will transfer, but not necessarily all of them. In that situation, I think probably more disproportionate the issue for a foreign medical graduate who's coming here trying to get degree transfer than, say, somebody who started medical school and didn't go finish it. But I think that's another type of example. And so there's a really wide variety of issues. And I think what's important about them is that it provides a great opportunity for folks from a lot of different perspectives to come together to work on addressing this issue, because fixing it really involves fixing it for a lot of people, that immigrants are really maybe the miner's canary of occupational licensing.
That's really helpful. And I think to your point, and to all the points that I've been making today, it's, there is such a wide variety of people that we're talking about when we're talking about foreign-born workers. And so I'm curious, this is a question for the general group. We talked briefly previously about, the Ukrainian programs that have started, Afghan humanitarian parolees, which is a weird term that I don't know why we use the term parole, but with the different cultures and needs and educational backgrounds that we have with groups that are coming, I'm curious, one thing I've been thinking about is how can state or local offices for new Americans really serve people effectively? We've touched on that they're kind of the hub or the convener in a lot of ways, but with the wide range of issues, how does that work exactly? And I'm looking, I don't think you can tell because I'm on Zoom, but I'm looking at Rich or Assistant Commissioner.
I can jump in, or Assistant Commissioner, you want to start, or you want me to start?
I can go after.
Okay, yeah, I'll just give kind of a national view, and then would love to hear how it's working here in Minnesota. But I think, Mary, to your question, part of what these offices add to a specific state's ecosystem is what I describe as like being the connective tissue between what is inevitably very diverse immigrant and refugee communities and state government, right? And so in addition to being like a trusted source of information and being able to kind of tailor programs so that they're cognizant of and addressing these unique barriers that we've talked about, I think they're also meant to be a little bit of a feedback loop. And so as these offices get stood up, one of the first things that we see them do, and actually in some cases, one of the things we see mandated with the same legislation that creates the office is a kind of parallel task force or working group, often referred to as a kind of New Americans task force, New Americans working group, that basically is comprised of leaders in the community from as many immigrant and refugee communities as possible, to be able to like inform the priorities and the scope of the office. They usually meet regularly. There's a little bit of an accountability mechanism built into a number of them. So I think that's part of it. It's like making sure that once the office is created, they don't just kind of make up their work on their own, but rather it's reflective of the needs on the ground. The other thing that we see a lot of offices do is some version of a listening tour or a focus groups with specific communities to be able to hear what their challenges are and what they want from these offices, right, as they're creating their scope of work. And so inevitably these issues of employment barriers, but all the things that come with that, lack of professional network, challenges with English language ability, credential evaluation, these things always come to the fore in conversations around what are the needs of a given community. And I think to the point we were making earlier, each community might have a different level of navigability, if that's a word. Like some of them might have a very clear idea of how to navigate a certain license or certain occupation, and others, whether they're new arrivals or just have not tapped into that knowledge base might have a tougher time. And so, the last thing I'll say is that one of the things I think these ONAs do more than anything else is add nuance to the conversation on immigration, right? It's like not all immigrant groups are the same, and quite the opposite. And so they're able to be that in-house expert to be able to recognize that and actually act on it. But Assistant Commissioner, I'd love to hear your thoughts about how that's working here.
Thank you, Rich and Mary. It looks like this is the question that that a lot of people have asked. What can ONA and by extension the state do to help immigrant and refugee communities? First, I want to say that we look at it in the state as a holistic approach. That means there's so many barriers that go beyond the credential work that affect a lot of the immigrant and refugee communities getting into the workforce. Starting with, some need more help than others. Starting with the culture shock. The first time someone gets here, that is even before you can even think of anything else, like the navigating their way around anywhere is just tough. And so that's where things like programs like DHS programs or wraparound services come in, case management and just teaching people how to the work culture and the ethics and getting there on time and transportation and all that. So those are kind of the very early interventions that the state does through programs. And then after that, of course, the biggest barrier is language access. And then you've seen that we have done in the last session, there's been a new office that was created, Office of Translation Enterprise, that will lead all the language access, translation, resource interpretation of state agencies throughout, and that will sit within the Department of Admin. And then there's of course the adult basic education for those who need just get into the and start learning. And then we of course always encourage innovative ways for like employers to have on-site education or ESL classes for those who have language barriers, and of course those people that need to improve their language as well. And then of course there is also the credential work that now we have been talking about, which I have to say we have not been up to that stage where we have removed some of those barriers completely. And we're definitely working towards that. And this is where now the second part of my job is to propose those, to work with you all to propose those and policies for change. And that's something we're hopefully to do. But in the meantime, I wanted to shift the idea to the workforce development engagements that we've been doing to make the workforce more inclusive. And the way the state normally gets involved in this is through funding to make the resources available for community partners, municipalities, counties, chambers of commerce and all that. And of course, the workforce development boards and all that. So that's the biggest intervention that we have done. As an example, it's also my job to show the resources that are there from this session. One key funding that came out from the legislature was the Drive for Five. That is I think it's out right now. But this is funding for 5 major industries that the One Minnesota budget has identified, and that includes education and healthcare, trades, and of course technology and manufacturing. These are high demand and of course family sustaining wage jobs that we think will support people of color, new immigrants, anyone who's been structurally or historically underserved to get into these industries and make a living wage out of that. So this funding will prioritize sector partnerships and for employment and training opportunities to help those folks into those 5 industries. When we say sector partnerships, there are employers, education institutions, training providers, local workforce boards, even unions and community-based organizations to meet the moment for the workforce challenges that Minnesota is facing. These sector partnerships, of course, always will ensure that education and training programs are reflective of the employer needs in Minnesota. That's one, money that's out there, about $20 million. And of course, sector partnerships, community organizations can send out the innovative ways to serve and address those barriers. Ways that, for example, I've seen people talk about removing the language requirement for the NCLEX, and in some discussions. These are all innovative ways, as I give as an example, to use these funds to come up with strategies that the employers, the education institutions, and of course the state will work together to remove these barriers. And then, of course, there's the targeted population workforce program that we're targeting specific communities that have been historically underserved to and get the skilling or reskilling or talent development for the underserved populations. Of course, I will mention the internationally trained healthcare professionals program that we had last year. This is where I did the state made available funding to about 6 organizations to specifically help people who've been who come in with healthcare credentials overseas to get services that will be helping them to get the credential. This include career coaching, counseling, degree translation, assistance to transfer international transcripts, fundings to assist additional requirement training for coursework, support services, all that, even job placement and assistance for specifically those who come in with a healthcare credential. And this is still, most of the partners are still implementing this work, and someone can call in and get into that program. Of course, the IMG program that's already been discussed, that has been there in Minnesota since 2015 is also another program. These are all resources out there. So in short, there's so many money out there, y'all need to apply.
Thank you so much. That's a perfect way for us to kind of close up our discussion. As circling back to what we said earlier, what Hugh touched on earlier is, we could talk about this for days. So I'm glad that we were able to have this time together to talk about it today. Like Assistant Commissioner said, there's so many different resources here in Minnesota to start to kind of build on that. So that's exciting. I want to turn it over to my colleague Ryan for final thoughts today, but thank you so much to our panelists for all that you offered today.
Yeah, I think this has been a fascinating discussion that really grappled with some concrete issues facing foreign-born workers and the states that are addressing those issues. I heard a few particularly interesting themes coming out of this conversation that I just wanted to articulate. Offices of New Americans are typically this hub within state government for understanding, coordinating, leading state efforts to address these issues. And we heard from Rich and from the Assistant Commissioner in detail about how this works. And I guess the question I ask myself is, why is this necessary? And what I infer is that this just hasn't always been a priority for state policymakers, and that the policy environment in which immigrants work is not one that's been shaped with them in mind at every turn. And I think that leaves a void for offices of New Americans to fill, first simply by identifying specifically what the challenges are, but then convening those who have the authority to address them. All of the panelists reference the unique barriers that immigrants face in accessing licensed employment opportunities. Veena in particular provided some really useful context on the larger constellation of workforce barriers that are implicit in our immigration system. And I think the complexity of those barriers means there's not one single problem or single fix for it. Then Hugh described the importance of a couple types of licensing barrier. I'm thinking of language proficiency and also information about licensure pathways. And this strikes me as a way that researchers can help. We can identify additional specific attributes of workers that matter in the data for licensure and for labor market outcomes. So to conclude, I'm really looking forward to following all the work that our panelists do in the future and seeing what the opportunities are for researchers to provide evidence that's useful to that work. Thank you again to our panel for sharing all of your expertise, and thank you to everyone watching for taking the time to be with us. I'd encourage you again to engage with us here in community development at the Minneapolis Fed if this is an active area of work for you. But have a great rest of your day.